What exactly is Alzheimer's disease? By definition, it's a progressive disorder that slowly destroys memory, thinking skills, and eventually the ability to carry out simple tasks. But beyond the medical definition, Alzheimer's is a deeply human story of families, memories, and the search for answers to one of the world's most challenging diseases. Today on Videopedia, we'll explore everything you need to know about Alzheimer's disease: what it is, how it affects the brain, what causes it, and the latest hope for treatment. Today on Videopedia, we'll explore everything you need to know about Alzheimer's disease: what it is, how it affects the brain, what causes it, and the latest hope for treatment. Alzheimer's is the most common form of dementia, responsible for around 60–70% of cases worldwide. It's not just normal aging, it's a disease that changes the brain itself. Patients first experience mild memory loss, like forgetting recent conversations. But over time, confusion grows, language fades, and daily tasks like cooking or dressing become impossible. Inside the brain, Alzheimer's is marked by two main changes. First are amyloid plaques, sticky clumps of protein that build up between nerve cells. Second are tau tangles, twisted fibers that form inside brain cells. Together, they block communication between neurons, causing brain cells to die. Slowly, the brain shrinks, especially in areas that control memory and reasoning. Alzheimer's usually progresses through 3 stages: mild, memory lapses, trouble finding words, losing track of time; moderate, difficulty recognizing family, wandering, major personality changes; severe, inability to speak, walk, or care for oneself. This progression can last years, which is why Alzheimer's is sometimes called a long goodbye. So what causes Alzheimer's? Scientists don't have a single answer, but we know several risk factors. Age, most common after 65. Genetics, certain genes like APOE4 increase risk. Lifestyle, poor diet, lack of exercise, smoking, and high blood pressure all play a role. The good news? Healthy habits like regular exercise, balanced diet, mental activity, and social connection may lower the risk. Alzheimer's isn't just about patients, it affects entire families. Caregivers often face emotional, physical, and financial strain. Yet many families also speak of moments of love and connection, even in the toughest times. This human side is as important as the science. Currently, there is no cure, but treatments exist to help with symptoms, improving memory, mood, and daily function. In recent years, new drugs targeting amyloid plaques have given hope. While controversial, they represent a turning point. The first medicines designed to slow disease progression rather than just treat symptoms. At the same time, researchers are exploring vaccines, gene therapy, and even AI-powered diagnostics to detect Alzheimer's earlier than ever before. So, what does the future hold? With aging populations worldwide, Alzheimer's cases are rising, but so is global effort. Scientists, governments, and communities uniting to fight back. So, what does the future hold? With aging populations worldwide, Alzheimer's cases are rising, but so is global effort. Scientists, governments, and communities uniting to fight back. Every discovery brings us closer to understanding, and every act of care brings dignity to those living with the disease. So what is Alzheimer's disease? More than a medical condition, it's a reminder of how precious memory is, and how powerful human compassion can be. This has been Videopedia, everything you need to know about Alzheimer's disease. If you found this video meaningful, please like, subscribe, and share. Because knowledge is not just power, it's care. This has been Videopedia, everything you need to know about Alzheimer's disease. If you found this video meaningful, please like, subscribe, and share.